Hi, it's Dr. Malik here from the Muscle and Joint Clinic. Thank you for joining our podcast. Today we'll be talking about 8 back pain myth busters. Your back has 2 main purposes. It allows you to stand, supporting your arms and legs, and it protects your spinal cord. The spinal cord communicates messages between your brain and the rest of your body. The health of your spine can affect your overall well-being. Most people experience low back pain at some point in their lives. Because it's so common, you may have heard many theories about what causes low back pain and how to fix it. But do you know the right facts? Here's the truth behind some of the most common back pain myths. Myth number 1. I need an X-ray, CT, or an MRI to figure out why I have back pain. This is the first myth. Most causes of short-term or acute low back pain will not show up on an X-ray, CT, or an MRI. A qualified healthcare professional, such as a physician or a chiropractor, is trained to know when you should have diagnostic imaging done. They have a series of other tests they can do to help you get to the bottom of what is going on. Myth 2. Bed rest is recommended for back pain. Bed rest may worsen your back pain unless your pain is so severe that you can't move. Myth 3. I just need to stretch my back. Before you stretch, it's important to get checked out to see if stretching is the right thing to do. Depending on the reason your back is hurting, certain stretches may make things worse. For example, if you have a disc problem, then you may want to avoid stretches that flex the spine and put additional pressure on your disc. A chiropractor can help you get to the root cause and show you which exercises and stretches will help. Myth number 4. Applying heat is recommended for a sore back. Applying heat may make the inflammation of your joint, surrounding muscles, and ligaments worse. Ice is the way to go for at least the first 3 days of short-term or acute back pain. Myth number 5. Pain is the main indication that something is wrong. Your back may be in trouble and you may not feel it. Restricted movement or discomfort in your arms, legs, and shoulders are also indications of spinal problems. Myth number 6. If I'm in a lot of pain, there must be a lot of damage. Pain is a sensation that acts as a warning system for your brain. Many things can set that warning off. A spine, muscle, or joint expert like a chiropractor can help you figure out if your pain is related to these parts of your body. It's important to remember that intense pain doesn't necessarily mean that there is significant damage. Myth number 7. This pain is so intense, I should probably head straight to the emergency room. Evidence shows that most low back pain cases are manageable and do not require an emergency visit. If you're experiencing a loss of sensation in the saddle area, or if you have lost bowel or bladder control, go to the emergency room immediately. Otherwise, your best first step is to find a spine, muscle, and joint expert, such as a chiropractor, to diagnose and treat the cause of your low back pain. And if the cause of your pain is serious enough to warrant the emergency room, these specialists will immediately send you there. Myth number 8. Now that my back pain is gone, I can stop doing my exercises. Once the pain stops, many people stop doing the things that help them get rid of the pain. It's important to make healthy back care and exercise a part of your regular routine. Otherwise, your back pain is likely to return. If you're experiencing low back pain, consult our chiropractors to assess your specific needs and develop a treatment plan that's right for you. Our chiropractors can be reached at 905-593-1605 for a free back pain consultation. Thank you for listening. I hope you enjoyed this episode of the Muscle and Joint Podcast. Take care and stay healthy.